This isn't hard, doctor. Can men get pregnant? Yes or no?
Again, I would be more than happy to have a conversation with you that is not coming from a place of trying to be polarized and push
I'm
people
not trying to be polarizing. I'm trying to ask, I think it is extraordinary that we are here in a hearing about science and about women. And for the record, it's women who get pregnant, not men. We are here about the safety of women and science that shows that this abortion drug causes adverse health events in 11% of cases. That's 22 times greater than the FDA label, another fact you haven't acknowledged, and yet you won't even acknowledge the basic reality that biological men don't get pregnant. There's a difference between biological men and biological women. I don't know how we can take you seriously and your claims to be a person of science if you won't level with this on this basic issue. I thought we were past all of this, frankly. I can't believe we're still here talking about this.
I am a person of science, and I'm also someone here who's here to represent the complex experiences of my patients, and I don't think polarized language or questions serve that goal. I don't think they serve the American people.
It is not polarizing to say that there is a scientific difference between men and women, and I want this to be clear and for the record. It is not polarizing to say that women are a biological reality and should be treated and protected as such.
I would be remiss if I didn't start by saying I heard my colleague, very passionately talk about the fact that this is about the safety of women. I want to make it clear that this administration and this secretary could care less about women, men, or children. In fact, they don't care about humans. And I want to be very clear. I could go down and delineate how that is true, but that is not the subject of today's hearing. But for the past year, we have all watched Secretary Kennedy and this administration peddle conspiracy theories and junk science to dismantle public health structures in this country. So I don't want anyone lecturing about the safety of women. These people don't care about humans. Last week, in fact, we saw the latest example with Kennedy recklessly eliminating the CDC's recommendation for a number of critical childhood vaccinations, and very alarmingly, including the flu shot. In the midst of a flu, basically a surge in a super flu, this is the moment that this man decides to eliminate the flu shot for children as a recommendation, just like with the pediatric vaccine schedule, changing the rules on FDA-approved drugs without scientific input, legitimate evidence on safety risk, or transparency will cause, we know, unnecessary fear for patients. RFK's same playbook is being used to target mifepristone, a safe and effective medication that has been approved by the FDA for over 25 years. Now, take all of the fear-mongering and truths that RFK spewed earlier last year about measles, mumps, and rubella vaccines, and take the fact that RFK agreed to reopen the case on mifepristone this fall, conducting its own very fake review of the evidence of safety and efficacy of this drug. That review was based in part on a study released last summer by the Ethics and Public Policy Center. Now, Dr. Verma, as a practicing physician, I would imagine that you read peer-reviewed research and journals fairly regularly. Is that correct?
Yes, I do.
And is the Ethics and Public Policy Center a peer-reviewed or rigorous medical journal?
It is not. That is a policy paper that you are referring to.
And in fact, EPPC's own stated mission is to, and I quote, apply the riches of the Jewish and Christian traditions to contemporary questions of law, culture, and politics in pursuit of America's continued civic and cultural renewal. Some of their recent publications include a post entitled, quote, Good Riddance, Governor Walz. Quote, another one is Liberal Women Have Abandoned Marriage. Another one, Ending Mail-Order Abortion would fulfill 3 Trump campaign promises, and the rights of women, a natural law approach. This is clearly not the work of unbiased science, but an organization with a political agenda, one based on the last publication I mentioned that promotes that women are, in their view, inferior and should submit to men. And yet their work is being cited by state attorneys general and members of this committee to roll back access to a drug that millions of women have used safely for decades. So, Dr. Verman, was EPPC's mifepristone study peer-reviewed?
It was not.
And did this study mix in data from miscarriage management and IUD insertion procedures that have absolutely nothing to do with abortion care?
It did mix in a lot of things that were not directly related, and also they were not transparent about their methods, so it's actually hard to figure out what exactly happened. Any peer-reviewed study needs to reveal their methods, their data sources. They did not do that, and so it's very unclear the specifics, but we can tell that patients that were coming to the emergency room, for example, for routine care because they couldn't get care otherwise in their communities, or patients with completely unrelated conditions were counted.
And so you're right. So this study included completely unrelated conditions as complications of mifepristone, right?
Absolutely.
And how would the inclusion of this data undermine outcomes?
It significantly over-exaggerates complication rates by, again, counting things that are not actually complications of mifepristone.
And let me ask you one other question. Time is tolling. In contrast to this sham study, can you describe the body of evidence of medical reviews and published clinical trials that reviewed the safety and efficacy of mifepristone? Sorry, so hard to say.
Yes, absolutely. We have over 100 years of high-quality, peer-reviewed data from multiple journals, multiple researchers. And based on that data, I want to highlight one thing quickly about the FDA label that was strategically left out, is that the label specifically says there has been no causal relationship between the use of mifepristone and misoprostol and any of the complications listed.
And I'll say this last thing and go. This study from this conservative think tank is not, in RFK's words, gold standard science. It is self-published, lacks transparency, cannot be replicated, is rife with conflicts of interest, and includes flawed data. I yield back. Thank you.
Senator Markey.
Thank you, Mr. Chairman. It is very difficult for me to ignore the irony and the hypocrisy of my colleagues on the other side organizing this hearing today. While my Republican colleagues frame today's hearing on, quote, protecting women, they don't appear to have cared about protecting women and families while they stripped health care from millions of people last year. Democrats warned that blocking the extension of the ACA premium tax credits would lead to skyrocketing premiums for 22 million Americans and their families, and that nearly 5 million people, particularly women and people of color, would lose their health insurance. But Republicans did nothing to protect women then. When Republicans and Trump added restrictions and paperwork requirements to Medicaid, Democrats warned that could cause millions to lose their health insurance, including 2 million young women. But Republicans did nothing to protect those young women. When Republicans and Trump cut almost $1 trillion from Medicaid to fund tax breaks for billionaires and CEOs, I warned in my study then that those cuts would put 300 rural hospitals at risk of closure, having to cut services like labor and delivery, making childbirth more dangerous for women in our country. But Republicans did not care about women then either. Now my Republican colleagues have spent all morning spreading dangerous lies about a medication that we have known is safe for over a quarter of a century. And why are they doing that? Because this was never about protecting women. It is about controlling women. Republicans have shown us that they will not stop until there is a national ban on abortion. And today's attacks are just another step towards that national ban.